Anna, do you want to make me a co-host so I can assist?
Absolutely. I don't know why it doesn't do the loud thing. Remember how it used to always say really loud, this meeting is being recorded when somebody pushed record? So just so you know, this meeting is being recorded. It did not loudly announce that over whoever was talking at the time, but we are recording you. So if you do not consent to having your image recorded or potentially shared on the internet, please turn your camera off. Or you're absolutely welcome to leave the meeting, but we'd prefer if you stayed and participate and just cover up your face with your cam by turning off your camera. I know that makes some people feel uncomfortable, so make sure you have the ability to consent to that by being aware it's happening. Chrissy, are you co-host now? Camera's just following me around. I was just in the last meeting with her. Okay. And are you sharing the PowerPoint or is that something you want me to do?
I will pull it up. Yeah.
Chrissy, do you want me to wait until 3:05 to start off or?
Up to you.
Well, I don't see anyone else knocking on the door, but that doesn't mean more people aren't coming. Um, well, and just as I said that, here's Karsten. Do you want to start with introductions, Christy? There are some faces in here I have never seen before.
We could, and I want to make sure that we have time to really get through the plan and hear people's thoughts. So maybe just invite to pop in the chat.
Sure, sure. If people would please, if you're comfortable, pop your name. If you feel comfortable sharing your pronouns, or if you're going to get offended if we gender you, tell us what gender to use when we refer to you using pronouns. And tell us if you can what you're representing, right? Are you here representing an agency? If so, what is it? Are you here representing lived experience, right? Just so we can kind of get a understanding of what lenses people are looking through as they're doing this work with us today. And we can move into the slides. So welcome. Thank you very much for being here. This meeting is the System of Care Learning Collaborative, and the focus of today's meeting is the 2026 through 2029 System of Care Strategic Plan. This is the very first community preview of the plan. So, way to be on the cutting edge. The full council hasn't even seen this whole plan yet. And so they will be digging into it in person on October 21st at the Portland State Office Building. We will have a remote option available for people to either view or attend that meeting online, but the bulk of the work will happen in person in the Lloyd District in Portland. So if you want to come and dig in, it is a public meeting. Information for joining that meeting is available on our website. And Corinna, maybe you can put the link to that in the chat. Um, Chrissy, is there anything else you want me to say on this slide before we move on? Okay. So our goals for today, as I mentioned earlier, we're going to preview the 26 through 29 System of Care Strategic Plan. We're hoping that y'all will be like, "Oh my gosh, I love this. I'm totally bought in and ready to do this work." If you're not, let us know that. And really help find out where you see yourself in the work, right? If there's something you see like that stuff I'm doing or my agency is doing, or I really want to partner with agencies or providers who are doing that work, that's where we want you to really identify. I'm on fire for this piece of the plan. There's a lot of work to go around. So where we've got folks who are excited about it, we want to steer you into that work as best we can. And we want to give you some clear understanding of where you can provide feedback and what kinds of feedback will be helpful to us as we are gathering. Today is the kickoff day for our public feedback period, and then we're going to integrate that public feedback into the plan before we finalize it and submit it to the legislature and the governor by January 1st, 2026. And I am perfectly happy for people to ask questions throughout. You can use the chat, you can unmute, and you can just say it, or you're welcome to raise your little Zoom hand. What I won't be able to see is if you raise your physical hand, I can only see a few of you along the side of the screen, so I may miss you if that is how you choose to try to get my attention. Okay, so for today, we're gonna go through what was the process, how did we get here, what is the framework for the plan, what are the vision that the plan is aiming towards creating in the state of Oregon, what is the mission, what are we gonna really try to accomplish, and what are the values that we have used across the plan to really try to make sure that every single thing we're doing is in alignment with our core values as a system of care. So the strategic plan itself is really made up of four primary goals and then the strategies that we will use to accomplish those goals, action steps underneath those strategies. The implementation plan as those action steps. Sorry, I'm being confusing. The strategic plan itself is the goals and strategies. The implementation plan are the specific steps we'll take to accomplish the strategies and the goals that live in the strategic plan. The implementation plan includes things like when do we need to start this work? When is the work due? Who's going to lead the work? Who's going to cheer and champion the work? Right? So that's really where the sort of rubber hits the road in terms of the doing. We also have, and we just left a data committee meeting where we were getting really in the weeds on how are we going to measure success. We're going to look at it in two different ways. We're looking at key indicators, which are sort of what's changing on the ground in terms of the work that we're doing. And we're going to look at process measures. So what's changing in terms of how we're doing what we're doing that's getting us closer to accomplishing those key indicators. And then again, like we said, we'll cycle back to how and when and where you can provide feedback. We've got a couple different mechanisms for you all to give us your thoughts. Anything else, Christy, you want to say on there? You just speak up whenever you want to. I'm just going to keep talking. Christy's kind of sick today, so I'm just like stepping up and doing as much as I can on this presentation for her, but she has really been the sort of lead on this, all the strategic planning work for the past 10 and a half months. So, Christy, if I'm missing things, you just unmute and say what you need to say, okay?
I will, no problem.
Okay. So here we are. How did we get here? We started with a gathering phase, which was really the first half of 2025. We engaged our partners at the Oregon Health Sciences University, or OHSU, to really assess the system of care across the board. Who's getting care, who's not getting care, what types of care are people getting? A lot of unanswered questions that OHSU simply couldn't answer because the data isn't gathered. So the question that I think logically comes after those ones I just named is, and how is it working for people? What are their outcomes? We don't have a lot of data in that space. And so that remains to be seen, and you'll see it. It is in the plan for us to learn more about that. We also had some consultants and contractors who helped support us in this. They and Christy and a bunch of our governor appointed members read related strategic plans like the Child Welfare Strategic Plan and the OHA Behavioral Health Strategic Plan, right? All of these policy documents, what's best practices with regard to expanding access to community-based care, what equity strategies are functional within a behavioral health system or within a healthcare system itself, right? So lots of different work fed into the foundation and the framework that we're using for the strategic plan. And then we did a number of outreach events with youth and families where they looked at those documents and those recommendations and came up with their own, okay, if we're going to say we want linguistic accessibility within our behavioral health system, what does that mean to youth and families? What would that look like? Where should we prioritize our efforts, right? If for the youth and families we're here to serve, what does that mean to you? So really trying to get community level feedback and engagement. We did outreach to each of the different local systems of care, those of our local system partners who had the capacity to hosted meetings, and Christy and I went and heard from those local systems. And we had 5 community-based organizations that work directly with our priority populations. Christy, if you can put those 5 priority populations in the chat so folks know who we're talking about. And they went directly to those populations and asked for suggestions and feedback about what the system of care that those people want to see would look like and feel like and how they would access it. So all of that work came into the strategic plan, and most of that work will be included as appendices in the final giant strategic plan document so people can see what did Morrison Family Services have to say about what they wanted us to do. What Rosemary Anderson, was it POIC? Nope, not them. Who are our five?
Pathfinder Network.
Pathfinder.
Wow. Legal involvement. Home plate for youth experiencing homelessness, Fact Oregon to reach to families and caregivers of youth with IDD, Eastern Oregon CCO for rural youth, and I think you mentioned Morrison already for families in the child welfare system.
So then we went through July and October. We started with a 2-day in-person retreat. We had about 50 people there, and they took all of that data that I just described to you and synthesized it into the draft plan, using staff and consultants to really hear them, document what they were saying, and then take it and turn it into a plan. Um, then now we are in the verify phase. So here's what we heard from January through October. Did we hear you right? Does this make sense? Are we going in the right direction? Are we aligned with the goals and values of the people in this room and the people that we've gathered feedback from, to really try to make sure that the plan is on point, or if it's not, where do we need to nudge it into alignment? Then when we get all that feedback back from everybody, we'll take a pause. I'll integrate it into the plan, make the changes that need to be made, and finalize in December so that it's finally public. We'll send it to the legislature. It'll be published on our website. We have to send it to the governor's office, right? There's some things within statute that say these are all of the places that you need to deliver the plan to. We're going to follow the law and do those things. And then the real work starts. We'll actually start asking our partners across the state to start doing the things that the plan says need to be done. And Christy put in the chat, priority populations for the plan were youth with intellectual and developmental disabilities, youth and families who are living in rural areas, youth experiencing homelessness, families with child welfare involvement, and youth with juvenile legal involvement. So those are the populations we're really focusing on system improvements to improve their access to care and outcomes from the care they get. One big priority coming really from the governor's office is that we are in partnership with the Alcohol and Drug Policy Commission around youth substance use disorder, early intervention, prevention, treatment, and recovery. And so the plan that you'll see includes all of the priorities established by the Oregon Youth Addiction Alliance, which was a partnership between the Alcohol and Drug Policy Commission and the System of Care Advisory Council that developed a number of specific policy recommendations. They are highlighted in blue in our implementation plan. They also live in the Alcohol and Drug Policy Commission plan. And so we're going to continue to partner and ask all of our partners in the state to partner on focusing on youth substance use disorder treatment, intervention, and care, and really looking for spaces where people can get substance use disorder care as young people without needing residential, right? You see very little access to substance use care outside of inpatient treatment in Oregon, and our youth and families are telling us that is not super functional for them. So we're going to figure out how to do better.
Okay. I think I'm gonna go through the framework now. So getting a little bit into like the actual like nuts and bolts or meat and potatoes of the plan. So this is the framework that was crafted. We've got a new vision statement, a mission statement, and value screens. The vision reads, in Oregon, where all children, youth, and families across all backgrounds are safe, well, thriving in their homes and communities, and supported by responsive and affirming systems designed with and for them. Our mission is to drive and organize system change that centers youth and family lived experience, advances community care, and eliminates barriers across systems through collaboration, accountability, equity, and advocacy. Super excited about that statement. And then finally, we've got 5 value screens These are slightly different than like the national system of care values. The value screens were really used to help identify strategies and actions that were in scope or out of scope. So these screens were used to really help us decide what made it into the plan. So when we were developing the plan, we considered things that center youth and families and children, things that increase awareness and reduce stigma, actions that promote sustainable change, actions that prioritize community care, and actions that advance equity by improving accessibility, affordability, and quality. Okay, so the strategic plan has four goals. The first goal is to improve access to coordinated, integrated, and community-based systems of care. Our second goal is to promote the co-creation of equitable policy and systems by providers and the youth and families they serve. Our third goal is to create sustainable infrastructure that increases the system of care's capacity and credibility. So this is very like kind of internally focused on the infrastructure for system of care at a state level as well as at a local level. And then the fourth goal is to transform the systems that serve children, youth, and families. So getting into each goal a little bit deeper, there are strategies under these goals. So, goal one, improve access to coordinated, integrated, and community-based systems of care. We've got three strategies here. The first is to increase services that are respectful and responsive to all cultural beliefs, practices, disabilities, and preferred and necessary languages tailored to lived experience. So, this is really about how we are creating and ensuring culturally and linguistically responsive services. Strategy two is about breaking down known barriers to better coordinate, integrate, and promote community-based care. So this is really about the services and supports that are needed today to help youth and families. And the third strategy is to support youth and family engagement in their care through shared decision making that emphasizes dignity, inclusion, and support. As Anna said, there are underlying action steps under these strategies, and we're going to give you just a few examples of what those look like in a little bit. So if you've got questions about like, what does that really mean and what are you really doing here, we're going to get to that. Goal two, this again is really about our process. How are we creating equitable policy and systems? How are we centering youth and families? How are we utilizing data in our work? So the first strategy here is to engage with youth and families in an affirming, honoring, and restorative manner. Strategy two is to write and implement policies, procedures, and accountability practices that are respectful and responsive to all cultural beliefs, practices, disabilities, and preferred and necessary languages. And the third strategy is to improve the integration, coordination, and efficiency of data sharing to inform policy and practice across the system with regular report to and feedback from youth and families. Goal three. So again, this is really around like our internal infrastructure and what we need to do to improve our capacity. There are five strategies here. The first is to build system of care capacity and sustainability through policies, procedures, and memorandum of understanding. Strategy two is to improve the System of Care Advisory Council and local system of care coordination through increased partnership, support, and information sharing. Strategy three is to strengthen SOCAC's membership through improved member support and member relations. Fourth strategy is to modernize the system of care data dashboard and really make SOCAC a trusted data resource. And the fifth strategy is to increase our capacity, SOCAC's capacity, through additional staff, technology improvements, and infrastructure. All right. And then the fourth goal is really about that long-term transforming the system, right? So where goal one is about the things that we need to do today to improve access to services. Goal four is about this long-term vision of really rebuilding the system. The strategies here are much more linear, so this one reads a little bit differently. And I think it'll make sense once we show you some of the actions. But the first strategy is to create a shared understanding of Oregon's current system of care and why it needs to be transformed. So this is things like communication, um, public information campaigns, really getting everybody to understand what system of care really means. The second strategy is to engage in strategic facilitated conversations with key partners, youth, families, and communities to create a shared vision for a transformed system. So this is probably going to look something like road shows and really going out across the state and engaging in conversations with people who care about this work and want to help rebuild the system. Strategy three is using that shared vision, using all of that rich conversation to create a transformative model. So, what is the new model that we need in place? Strategy four is to access the support and resources that are needed for that transformative model. So, what are the funding mechanisms? Where are the partner buy-in? Where are the champions for that new system? And then strategy five, hopefully, is the actual creation of pilots, regions across the state who will pilot this new transformative model that includes youth and family feedback and quality improvement mechanisms. Again, this is a 4-year plan, right? So strategies one and two are probably work we'll enter into in 26, 27, and hopefully by the time we get to 29, we'll actually be implementing some new pilots and really demonstrating this new model. Okay. Anna, I'm gonna hand it back to you to talk a little bit more about the specific actions.
Sure. So the strategic plan itself is sort of a written document that's like a Word document. It's in sort of prose, right? It has a lot of the information that we just shared with you, how we got here, what we considered. The implementation plan is very focused. It is an Excel spreadsheet that says step this, who's going to be responsible for it? Like who's the SOCAC staff lead that's responsible? Who is the appointed SOCAC champion for this work, right? What key partners do we need? Is this a policy change that agencies are going to have to implement? Is this a practice change that providers are going to have to implement, right? So we're going to get in and name those things. We haven't done that. That'll happen on October 21st. Timeline, when are we going to start it? When do we want it done, right? And so some of that is going to have to look at what work needs to happen first so that other work can happen later, right? If something is dependent on something else happening, obviously we have to do the something else first. Progress indicators, so it's not started, it's in progress, or it's complete. That will help us track progress as we work our way through the plan over the next 4 years. And then just notes around implementation and resources, comments that people have made about um, equity considerations or rural versus urban implementation and considerations we need to make there, right? People who came to the 2 days of in-person strategic planning should see pretty much everything that was discussed at that meeting. In those implementation and resources notes, we really took verbatim notes from people and included those in those resources notes. The implementation plan, maybe not including all of that level of detail, but the staff lead, champion, timeline, due date, key partners, those things will be publicly available on our System of Care website, and we'll update it as we go through so that folks can see what's been started, what's in progress, what's completed, those kinds of things over time as we work our way through. As an example for goal one, there's a strategy in there to break down barriers. One of our strategies is strategy number two, break down barriers to better coordinate, integrate, and promote community-based care. And some of the action steps that are in that implementation plan, which are going to help us achieve the strategy, are tackle barriers related to entry-level services. So in helping people access lower level community-based entry-level type services as opposed to focusing on crisis response services, which is something our system has really prioritized over the last 15 years. Implement more school-based services and supports. This was a big priority from the Oregon Youth Addiction Alliance. Really use schools as that sort of doorway for lots of services and supports, and decrease barriers for respite care, which has been a council priority for the past couple of years. So those were action steps that youth and family said, we need to do these things They are highlighted in the implementation plan in green to say these are the priorities of youth and families. These are things we're going to start tackling first because it's been prioritized by the folks who are the center of the plan. So for strategy one, under goal two, which is engage with youth and families in an affirming, honoring, and restorative manner, I will say this is a strengths-based way of sort of reframing, like systems will stop traumatizing people in order for them to access care, right? So this is the flip side of that. We're going to encourage our systems and support our systems in promoting, affirming, honoring, and restorative access to care. So some of the priorities that youth and family identified and how do we accomplish that strategy is implement whatever the youth are going to prioritize what in our youth engagement plan that's already been drafted do we need to do first, second, third, fourth, right? How do we implement that in a way that gets us closer to affirming, honoring, and restorative systems? Same thing for our family engagement plan. Our family advisory committee is really digging into what does a family engagement plan need to do first, second, third, and fourth, right? So that we are working together across systems. And those plans focus both on System of Care Advisory Council. What do we need to do to better support meaningful youth and family leadership within systems change work? And focus externally on what do our system partners need to do to better support meaningful youth and family leadership in the systems change work that may be happening at child welfare or may be happening within the medical physical health system, right? So we're trying to create some shared expectations for how systems partner with youth and families over the course of time. For goal three, one of the strategies under that goal is to improve System of Care Advisory Council and local system of care coordination through increased partnership, support, and information sharing. These action steps were prioritized by local system of care coordinators, as well as youth and families who are participating in one level or the other of the system change work. So action steps prioritized under that strategy are to create a dedicated bi-directional communication channel. So local systems of care and SOCAC are actually talking to each other back and forth, and it isn't just like the System of Care Advisory Council telling local systems of care what to do or what not to do. To include one local system of care coordinator or one member of a local system of care on each of our different System of Care Advisory Council committees so that we've got that bi-directional communication happening at the committee level. To support and encourage the state level council members to attend 2 to 3 local or regional meetings on an annual basis so that we have better understanding of what's happening at that local and regional level. Request resources for each local system of care to have a quote, Joylene. For those of you who don't know, Joylene is the state's youth and family engagement strategist, and she does a ton of really good work supporting youth and families and creating the system. She says her job is to create a table that has seats for all the youth and family members that are actually comfortable for them to sit in, so they don't have to carry their own stool to the table so that there's a place for them to sit. There can never be another Joylene. I know that's why it's a little bit of an internal joke that we left that in the plan to have a Joylene. That was somebody's exact words when they said what they wanted to see from other systems. Execute technical assistance dollars for local system of care, learning collaboratives, and orientation. So investments, actually money to support learning collaboratives and orientation support for our local system partners. Investigate and make changes to the CCO contract to improve partnership. This is a down the road thing. There's enough movement and challenge going on with CCO contracts right now. We're not trying to put our foot in that, but we are looking at in 27 or beyond when there are changes to the CCO contract. Does it make sense for some system of care stuff to be changed or improved or added or subtracted or what to that to make it more effective as we partner? And build local system of care capacity for data-driven decision making, thinking about, is it technical assistance? Is it more Codys in the world, right? Cody is our data analyst. Does each local system of care need a Cody as well? That's a question that we'll be answering together over the course of the next few years. And for goal four, the sort of system transformation focused goal, one of our strategies is to create a shared understanding of our current system and why it needs transforming. And so, one of the first steps that we'll be taking there will be to create a communications campaign about what is system of care? What does that mean? What is the System of Care Advisory Council? What do we do? What are our local systems of care? What do they do? How are they similar and different across the state? That has thoughtful branding and marketing and is accessible so that we're all starting with the same base information about where we stand today, what's our baseline, and then we can start figuring out where do we want to go from the ground we're standing on today.
All right. I'm going to talk just a little bit about the measures, and then we're going to stop talking and hear from all of you because we're really excited to hear your thoughts and your questions and your initial reactions to this plan. So, in terms of the measures, we've got two sets, as Anna said. We've got some kind of 8 key indicators. These are big, very kind of high level, multifaceted measures that are going to, may not realistically change a whole lot over the next 4 years, but really help to communicate the general things that we want to improve and the types of changes that we would like to see as we move towards our shared vision. And then we also have a series of process measures. Those are a little bit closer to the work. Those speak to our progress implementing the strategies and the action steps. We're aiming for about 5 of those measures per goal area. And all of these measures have been really developed and discussed by the data committee. And so some of these are still to be determined, not quite final yet. So it might be a little bit subject to change. Okay, so our key indicators, we've got 8 of them, coming from a variety of data sources. The first is to increase the percentage of youth reporting they have a safe place or person they can go to outside of school. This is coming from the Student Health Survey. Our second measure is to decrease the percentage of youth with an unmet mental health care need. Again, that's coming from the Student Health Survey. Our third measure is to decrease the percentage of youth with a substance use disorder. That comes from the National Survey on Drug Use and Health and really helps to tie this plan to the work of the Alcohol, Drug, and Policy Commission. The fourth measure is to increase the number of youth who are receiving intensive in-home behavioral health treatment, Fidelity wraparound, mobile response and stabilization services, and behavioral health treatment foster care. These 4 services are specifically named as they're called out in SOCAC statute. So these are the 4 services that were specifically mandated to provide oversight on. So we're going to be reporting on the number of youth accessing these services. The fifth measure to decrease the percentage of youth boarded in an emergency department for a behavioral health related crisis. That will come from OHA. The sixth measure is to increase the percentage of system-involved youth who graduate from high school on time. This is data kept from the Department of Education. System-involved youth specifically here means youth with disabilities, youth who are involved in the child welfare system, and youth who have history of involvement with the juvenile legal system. The seventh measure is related to suicide attempts among youth. We've got 2 data sources for that, both the Student Health Survey and hospital discharge data. And then the final measure here is to decrease involvement with child welfare and juvenile justice systems. This data comes from the System of Care Data Dashboard. We'll also be looking to decrease the number of youth who are involved in multiple systems over time. So those are the indicators. There'll be baseline data for all of these measures in the strategic plan. There's also a bit of contacts and disaggregated data that will be incorporated into the appendix of the plan as well. Okay. And then some of the process measures. Again, these are still being developed, but just to kind of give you an example of the types of things that we are proposing we look at. For goal 1, we've got 2 examples here. One is to look at the number of registered peer supports. This would be both family support specialists and youth support specialists. That data comes from OHA's Traditional Health Worker Registry. And we'd also like to look at school districts, the percentage of school districts who are billing Medicaid for school delivered services. Within goal two, we've got examples of two measures that will come from a new system of care infrastructure survey. This is a new requirement of our system of care grant to our regional system of care partners. So they're going to be required to complete this infrastructure survey for us. It's going to provide a lot of really valuable data, and we're excited that we'll be able to use that data in the strategic plan. um, Happy to drop a link to that survey so you have a sense of the types of questions that we'll be using. But there's some data in there that we'll be able to use to measure whether or not, we're using a family-driven approach or a youth-driven approach. For goal three, we've got one measure here that's coming from the National Survey on Children's Health, which is the percentage of families who report a well-functioning system of care. And another measure here that will come from that infrastructure survey. So the percentage of systems with extensive commitment from child serving systems, policy and decision makers, providers, and managed care organizations or CCOs. And then goal four, it's been a little bit tricky to identify some relevant measures. This is going to be very process heavy, but just as an example, we might be looking at things like the number of in-person visioning conversations we have, right? We're going to hopefully do a road show and really move around the state and hear from people. So, how many conversations did we have? By end of 2029, how many regions did we actually pilot this new model in? Um, so that's a little bit of what we are looking at for the process measures. Okay, I think that is the last. Yes. So that was a lot of information. I'm sure a lot of you have some questions. We do have, lots of time for discussion. We've got some questions for you, but let's pause here and see if there's anything that you might want some clarification on.
Hi, this is Carl Thomas in Southern Oregon at Project Youth Plus. I don't have any questions. I just want to say, well presented. I followed everything, and when I had questions, you eventually answered them. Um, guess my main comment is, um, I'm thinking the work may be a bit of a heavy lift. I'm anticipating politics are going to be involved. Um, so I'll be looking forward to how my small little CBO and the business my wife and I run, the work we do, how I can get involved. But thank you for the presentation. I followed everything.
Thank you so much, Carl. Glad it was clear. Yeah, and I'd love to know a little bit more about Project Youth at some point. So hopefully we can connect. Um, Anna, do you want to say anything about this plan in light of all the things happening in the world? And I'm sure it's on people's minds.
Sure. Yeah. So, we had some conversations when we were at the 2-day retreat, and we've asked for guidance from the governor's office about some of the politics that Carl was kind of referring to, right? So there's the politics, and then there's like the policy changes, right? Like HR 1 is absolutely cutting funding for some of the programs and services that we're talking about right now. It is cutting funding for other programs and services like SNAP, the Supplemental Nutrition Program that helps people access food security. People are going to lose their benefits, and that's going to push some families into crisis in a way that our system is not yet ready for. So, when we think about sort of a corollary, when COVID happened, we knew that we were in a public health emergency, and the federal government sent out some pretty flexible funds to say, okay, as you're trying to build up your systems, here's some money you can just sort of throw at the problem in the short term. The opposite of that is what's happening now, right? So not only are people going to be losing access to Medicaid funded services and federal nutrition benefits and things like that, Also, our systems, as those transitions are happening, are losing funds that they had previously had. So we're going to see pretty dramatic tightening. And what I'm worried about, to be honest, is that people will kind of go into their corners and start fighting for the resources that pay their staff or their bills, right? That's super understandable. And that's going to be really challenging for us as we navigate this. Like we really want to build a fully functioning, very open system that has big, broad doors so that people can get access to the care that they need. That is counter to what we see happening in HR1 and what we see happening with some of the other Medicaid cuts and challenges that are happening at the federal level. So we as a state of Oregon are going to have to really come together and stay in alignment around how do we protect access to services. It may be that we're losing funding for, I don't want to say any specific service because we don't know that yet, right? Part of the challenge is that nobody really knows what's getting cut and how it's going to get cut. But if we have some duplications where child welfare has a crisis response service and our county behavioral health partners have a crisis response service for youth and law enforcement has crisis response services, right? So as we see things getting cut, how can we combine and protect access so that the people who are being affected at the bottom of the system still have access to the care that they need to the greatest extent possible, right? So we've talked a lot about where's the floor? How do we make sure that there is a floor within Oregon below which nobody has to fall, right? We're not going to be cutting dialysis services to protect something else. Like if something is a life-saving service, we've got to protect that. I think of behavioral health services as life-saving services. I think we all probably do, right? If someone's having a behavioral health crisis, it could lead to the end of their life in a variety of ways. So that for me is part of the floor. We are going to do everything we can to avoid cutting access to crisis response services, to outpatient services, to inpatient care. That said, there's a lot we just don't know right now. And so this plan hopefully will serve as an anchor for us to come back to and say, okay, is this part of the values that we as a system have bought into? How do we maintain those values and that commitment as we have to walk through these very difficult decisions around budgets? So my hope is that this can be an anchor for us and a guiding light for us. That said, hard conversations are looming starting in the short session, legislative session in February. I see some comments in the chat around this. Karsten saying having good and reliable data will be helpful and foundational. Absolutely. And trying to make sure that that data is asking the questions that we want to have asked, right? Isn't washing out differences between groups so that we can see if we're having parts of our population be more heavily impacted, we're attending to those people and not just having them get washed away because they're a small part of the system, but a very important community that's getting overwritten by the data in the data by other groups that aren't being as heavily impacted. So being able to disaggregate data by geography, by race, by gender, by disability, that's really important as we navigate these cuts so that we can see if there's disproportionate weights falling on people. We're aware of those things and we're responding to those things. So we're going to have hard conversations. We're going to have to say the hard stuff out loud. Tammy?
Yeah. I have this kind of overwhelming sense of anxiety in my body as we have this conversation. And a couple things that are emerging for me, and I just I think this is the place to let them land. One is that in the midst of the unknown and cuts that we're all, anticipating, I'm curious what SOCAC's role is in developing more of the cross-functional relationships outside of behavioral health to do those things that you just mentioned, Anna. And I want to be careful as I say what I'm about to say. Like I'm not supporting cuts or happy we're going to have cuts. And I think this is the time that it tells us, are we good partners and stewards or are we not? And I think we see places where we're not good stewards. And I just wonder how that might show up in the plan. Um, yeah. The other thing that emerges for me as I listen to some of the examples, is that a lot of this is stuff that we have had conversations about, and they end up being in various strategic plans. You know, the words, I think the words are genuine, and yet, how are we thinking about doing things differently? And the biggest example that keeps coming up for me is I see school-based services as like one of the strategies. I think it was, or related to one of the strategies. And yet I know that there are increasingly numbers of communities that are not sending their kids to school because they're fearful that they may not see them again. There are communities in which, when we talk about mental health and suicide and other kind of behavioral health terms, it doesn't resonate in those communities. And so as we put this plan together, my question is the intention to serve the same constituent base, or what is the plan to move outside of those more traditional systems to serve communities that have historically not been served by strategic plans? And I don't expect that there's like a magic answer or wand that gets woven to those questions. I just think they just continue to come for me in these conversations. And so I just want to bring that into the room.
Thanks, Tammy. Those are big, hard questions. So I wish I had a magic wand. I would absolutely wave it for you. Um, I just sort of, in terms of the last bit about who is this plan really crafted to serve, right? The priority populations, which were identified using the OHSU study, were youth who have intellectual or developmental disabilities, youth and families in rural areas, youth experiencing homelessness, families involved in child welfare, and families or youth involved in the juvenile legal system. And so, in terms of who is being left out, who are we not focusing on in those, right? Those are really the laser focuses that we're going to be having as we work through this plan. There's always a margin of the margin, right? And so we may not be able to solve every person's problem, but we have an equity strategy that's really been led by our DEI committee that prioritizes equity within those populations. And how are we looking at folks who have had historically been prevented from getting access to assessments, early interventions, right? How do we increase access for those folks to the types of services and supports that other families in Oregon have had an easier time accessing, right? So we're trying to really focus on margin to center as our equity strategy, and then prioritizing those populations that have historically had the worst outcomes, which is why those are the top 5 populations in Oregon that have historically really not had their needs well met by our systems as they exist today. So will we cover every single person that's been left out? No, but those are the left out people that we're prioritizing and focusing on for the next 4 years. Christy.
Yeah, I think the other thing I heard, Tammy, in your comments, and I'm really grateful for them, is I think some skepticism that actually we're going to do anything with this plan, right? Because I think we all know and have many examples of plans that were made with great intents and lots of community engagement, and then nothing happened with those plans. And so I think, um, you know, the SOCAC team and our five five person team is really committed to actually taking action and committing to the things that we've heard people want to see happen. And to make, there's going to be some changes in our structure and our committees and our work groups, and you'll hear a little bit more about those things and those changes in the months to come. But that really is to like make space, right? Like we know this isn't working. And we need to be courageous and make some changes, and that might be a little bit uncomfortable, a little bit scary. Um, but just know that, we are really committed to getting this plan moving and giving it some legs. So, um, and I want to call out, Corinne had a question about involvement from the legislature. Is there strategy around how to share this with our legislature, our legislative reps, and are they involved? Have they been involved in the strategic plan, or are they aware of it? Oh, I'm sorry. You responded. Is there
I
anything?
was typing that while you were reading it out loud. So, yeah, I'll just say it out loud as well. They are aware, at least the ones who are paying attention during legislative hearings. Both Annalise Dolph and I have twice briefed them on the fact that the plans are coming, sort of what the general overview of the plans are, what the priority populations are, and the fact that these plans are coming out in January. Our legislative report that just went in on September 15th asks the legislature to use the plan to drive its work as it sets out its policy priorities in the sessions that follow the release of the plan. And then the governor's office as well as reviewed both of our plans and will continue to review those plans and as trying to use those plans to set their direction in terms of partnership with their legislative partners as well. So they're aware. I mean, can we make them do anything with it? No, but we'll do everything we can within our power to get them to buy in and use it as a foundation for where they take the system moving forward. Also, it looks really cold where you are, Corinne. And then I saw a question about youth engagement. I know Jesus Nunez Pineda, our chair of our youth council, is here. I don't know, Jesus, if you want to be put on the spot, you're welcome to ignore me or just say no, thank you. But if there's anything that you want to say about youth engagement and the leadership that the youth council is doing, you are super welcome to speak up and share.
Yeah, I mean, there's nothing like super major, I guess, to really like highlight, but we are actively working on finalizing our kind of youth engagement plan that was worked on in collaboration with the Oregon School-Based Health Alliance. I think I got the acronym right.
Yes, you did.
Um, Sweet. I'm normally terrible at those. Um, so that's something to kind of look forward to. We're not really sure where we're at right now in terms of kind of getting that out and digestible, but that is in the works. Um, to a couple of little highlights here and there, trying to kind of really work on our just communication and outreach structure, because historically the systems of care have been kind of lacking on getting the word out about them, um, as well as how to properly engage youth in meetings to make it more uh, safe is kind of a buzzword now, but to make it more digestible and actually build that strong retention in voices. So yeah, so some brief highlights for me.
Thanks so much. And then I see Corinne. Corinne, you're all active in the chat today. Can we get a lobbyist or something? Sorry, no. We asked if we could hire like a government relations person. You have to get approval from the legislature, and the answer was that we cannot. And so I am a registered lobbyist on behalf of the System of Care Advisory Council. But we don't have, we are not allowed to hire a government relations person to really lead that advocacy work, nor are we allowed to enlist a contract lobbyist. So We may at some point have like a communications person that does part-time government relations is sort of the best we were able to kind of finagle. And so we're hopeful that we can bring that person on sometime in 2026. And then we do get lobbying support from DHS Child Welfare and OHA's Behavioral Health Division. They've both sort of shared their government relations people with us historically and through memoranda of understanding. I don't know if there's more people want to say. I saw Karsten responded as well.
Yeah, I mean, I don't know. I just know that there was a comment from Marina around CCOs possibly having lobbyists. I don't, I cannot obviously commit a lobbyist. I don't know anything about that, but I am happy just to ask the folks in my circuit if that's like a viable option.
I love it. I mean, they can't say yes until we ask, right? Otherwise, it's just always no.
That's right.
Tammy, see your hand up.
Apparently, I have lots of thoughts today. I was curious, and this may have already been done. Has there been like a crosswalk between the different strategic plans from different groups? I saw in the chat there was some question about some other plans, but I think about other leadership within OHA, the governor's office, and some of the, maybe they're not even called strategic plans, but some of the priorities that are trying to move forward. Has there been a process to crosswalk those to maybe leverage resources across multiple plans? And I'm asking that with the lens that, resources are limited, and how do we collaborate to leverage the most out of what we do have?
So, Christy, I know you can start, and then I have some maybe more recent things I haven't shared with you yet that I'll add in after you respond to Tammy.
Yeah, yeah. Thanks, Tammy. I think, yes, one example of probably a few that we could look to in the plan. Um, there is this very massive Excel sheet that we fondly call the look back document. And this was an effort to look at the variety of policy recommendations that have been issued by the legislature, by the Secretary of State, by you name it, right? Lots of groups have come together over the years to talk about how can we fix this system once and for all. And so we have this great resource, right, that kind of like collates all of those reports, categorizes the types of recommendations that have come out of that report. And so one of the action steps within, I believe it is Goal 2, Strategy 2, is to convene a group. This might be like a new work group of the council that includes youth and families to really go through that report in detail and prioritize, like, okay, of, these 150 things that have been, put out as ways to fix this, what are the 10 that we really need to work on, and what is the legislative or policy mechanism to make that change? So that's just like one example. It's not strategic plan so much as it is, kind of looking at the rich body of conversation that's been going on around this for years, literally. Anna, did you have another thought, or was that what you were going to think
Well,
about?
and I was just going to say, so, and then, as we are sort of bringing this plan to different places and saying, does this make sense? Is it in alignment? Right. Some of the folks that are getting that question are the leaders of the different systems that are mandated partners. And so we're hoping that we'll have a letter that will be included in our strategic plan that will be signed by the director of the Oregon Department of Education, Oregon Department of Human Services, Oregon Health Authority, and Oregon Youth Authority that says, we see this plan, we like this plan, we're committed to implementing the work in the plan, right? So that we'll have their sort of express public statement of buy-in. And to Christy's point, we did really try to make sure that our plan was in alignment with theirs so that we're not trying to add a bunch of new work, but that they're seeing where those connection points are. And then, like, I was one of the reviewers for the Families First Prevention Services plan that's being drafted now. And OHA is sharing conversations around how can they be in alignment with that, right? There's a lot of intentional overlap, and it's happening in a number of different spaces, as well as the governor's office leading on the behavioral health initiative subcabinet, really saying, okay, how are all of the systems going to work together to achieve this shared goal of reducing out-of-home placements or increasing access to community services or other things that live in our plan, but also exist in those other plans as well.
Hi, Chris.
I just want to say I love it. So like I was starting to try to write it in the chat, and there are just so many pieces and parts that really do pull in from what we've heard. And I love the centering of youth and families, because for us in Eastern Oregon, that's really been where we found the people who wanted like dig in and work, has been youth and families with lived experience. So we're going to meet on Tuesday morning and really just dig into this draft, My Systems of Care team, and dig into it. And we are like super excited about it. We would have done it this week, but I had a bunch of people get sick. But we have been taking everything before our youth and families to get feedback before we've done it. They looked at our policies and procedures and all of that. So I really do like it. I think it's a large lift. So this is just me. I want to like, it's a large lift. So, but thank you.
It is a large lift, and we've got 4 years. And like any good plan, it's going to change over time, right? This is going to be a living document that we're going to like refer to, and it's going to get it's going to be like a good cookbook, right? It gets kind of messy and stained, and um so yeah, it is going to be a lot. I think part of the conversation that we'll be having with the council next Tuesday as well is like, okay, of these things, like what are the things we need to get started on first, right? What are going to be the most important actions for 2026? And we'll take it a year at a time, and I think that will also help make it a little bit more digestible for folks.
I see you, Heather. I just want to say in response to Chris, like the conversation that we had specifically with your youth and family around this plan originally, like months and months ago, was so like practical and applicable, right? Like the suggestions that they were making in terms of solutions were like, oh, that makes so much sense for very rural Oregon, right? And so like I want you to know that you were very heard. You the broad you, not you, Chris, right? Your community and the folks that you brought to the table were so incredibly helpful. And just like their voices should be reflected in this plan. If they don't see themselves reflected, we really want to hear that from you when you have a chance to review it. Heather.
Hi. To piggyback off of Chris, I also just want to give kudos for what's been developed here. Every time I hear you guys talk about it and give updates, it just gets more exciting to see it built out with measures and, things that we can actually use to kind of monitor progress. And I also think it just speaks to the essence of system of care as a whole. And having been around for about 5 years now, you somehow encapsulated everything. I feel like everything that us as local coordinators and our partners have been saying out loud for years and years, and have kind of rolled them up under those broader goals that you have. And so just really grateful for the time you all have spent putting this together, and really being responsive and listening to what the local levels have been saying. And I'm just excited to see how it unrolls or unfolds. I don't know what word I'm trying to use there, but we'll see how it goes. And just excited for it to be, I guess, like a bright spot despite all of the things happening in the world. I think there's a lot of good that you can do through that. So thank you.
Thanks so much, Heather. And then Corinne wanted to maybe go back and talk more about the key indicators or the measurement work. Christy, I know you put it in the chat, but do you want to flip back to that slide, or what's helpful to go back and dig in on that conversation a little bit more?
Yeah, I think, Corinne, your concern was about the wording of the SUD indicator.
Yeah, well, kind of just in general, I wanted to get another look at it. I mean, overall, like I'm really excited about all of them. I think it's going to be super helpful to keep us on a roadmap moving forward with something that we've been, all trying to do, but now we actually have something that can help us get direction. But I am curious if there's opportunity to kind of reevaluate some of the language. I'm only saying that because the substance use work in our region has come up a lot around wanting to have more of those diagnoses so that kids can get access to some of the substance use related interventions that come with the diagnosis.
Mhm.
And so I'm just wondering if there's I don't know, opportunity to kind of flesh some things like that out yet. Like if we're still in a place of like, okay, let's revisit this one. Is there another is there something else that we can use as a measurement? Or maybe it's already been discussed and people are like, yeah, we thought about that and this is why we went this direction.
Yeah, that's a good catch. There is still time. We're hoping that the council will take like a formal vote on these measures as part of the entire plan next Tuesday. So, yeah, I appreciate the comment. I will bring this back to Cody and Andrew, and see if they have other suggestions or, want to change it.
I think in particular, just to use as an example, in case it's helpful, is like the opioid use. Like that comes up with youth and they need the diagnosis in order to get some of the like harm reduction medications at a particular age. Since they are youth, there's like a lot more that goes into receiving that service. And so yeah, just want to put that out there in case there's opportunity for you guys to discuss it.
Super appreciate that, Corinne. And I think, one of the things, particularly, to just stay with that example that you used around medication assisted care for youth with substance use disorder and opioid use disorder specifically. While our overall goal may be at the end of 4 years, we want to see a decrease in the percentage of youth that are identifying as having a substance use disorder. We may even talk about we want to see that number go up in the short term, right? One of the things that back in my previous days, I was a violence prevention coordinator. And when we were doing really good work around defining what dating violence and interpersonal violence was in a community, the first outcome was that our numbers would increase because more people were identifying as like, oh, that's me, right? And we're comfortable. The stigma was reduced for them to self-identify as a person who was experiencing that negative experience in their life, right? And so you often will see when you're doing good work that your prevalence numbers will go up because you've reduced stigma and you've created opportunity for folks to get assessments that opens the door for care. And so I think we can be really honest about that fact. Even if we keep that number as one of the things we're looking at, we want to be honest about the fact that in fact in the short term we want that number to increase, not because we want more kids to be experiencing substance use, but we want to be identifying every kid that is struggling with substance use so that then we can create the structures to respond to them, right? So while we want to decrease the number at the end of 4 years, we may want to see that number increase at year 2. And Christy, Tamara has a question in the chat about modified diplomas for a system involved youth. Are we counting them in that reaching graduation, or are we only talking straight regular diplomas? I don't know how that number is calculated by the Oregon Department of Education.
Great question. I do not know.
But we can find that out. Yeah, correct.
I do not know either, typing it because I thought I might be asked.
Yeah, in the full plan that we'll be sharing out more publicly, hopefully next week, if not week of the 25th, there'll be the inclusion of an appendix. And there's an appendices that has kind of additional details and contents about each of these indicators, including disaggregated data and a little bit about the data source. And so some of your data questions might be answered there.
And there's also, we have just left our data committee meeting where we were talking about this, like we have some folks who really want to set a baseline and then only compare to that baseline over time. And so like whatever indicators we pick, now we want to maintain and keep measuring using those same indicators in 4 years and 10 years. We have other folks who are like, if that indicator isn't measuring what we want it to be measuring, let's find a new one. Right. And so there's sort of a philosophical conversation happening about like, does that baseline really matter all that much? Or do we want to be adaptive over time as new indicators come online that maybe are more effective at answering the questions we're asking? Can we change and do new measurements? So that we have not, as a community, achieved an answer to that question. Tammy.
Okay, this conversation is, I'm going to ask a question about one of the indicators that I saw, and I don't remember which one it was, had to do with number of family and youth support specialists on the THW registry. And I think my question about that is will that really be a measure? Or are we really wanting to know how many certified family and youth support specialists are employed? And part of the reason I asked that question is I have been participating in another work group that's looking at behavioral health, the workforce continuum. And what is emerging is that there are peers trained, viable, ready to go to work, but our systems don't have all the mechanisms to be able to employ them. And so we keep talking about a workforce shortage when some of those workforces on the continuum are actually out there, but we don't know how to embed them in the systems. So I was thinking about that indicator, and are we really wanting to know how many of them are employed, or are we just counting how many have been certified and still are just not working in the field? Anyway, just ask the question.
Yeah. Yeah, I have a bit of a response, but Lan, I see your hand up. Do you have a
Well, I just wanted to add to that because OHA allows certified recovery mentors to bill Medicaid also, and so many of them are not choosing to register as peer support. So we're losing a lot of that workforce even in that tracking. So I think I was following the issue. Sorry, I was multitasking, but so yeah, that's another layer that we're not going to get that data if we're just looking at the peer registry.
Yeah, that is a definite limitation of that measure. The other place that I believe we could look to for data on peer supports is the CCO traditional health worker report that they submit to OHA, but that would only tell us peers who are employed by CCOs.
No, it tells everybody in the network, but like I said, we have, several hundred peers, but over the next few years, they're going to drop off because they're only going to be certified recovery mentors and not registering as peer support. So the CCOs counts are going to be lower as well.
Yeah, okay.
But we can count peers, like we have a large housing agency here, and we support them through various contracts. So we include those peers who are in community-based organizations on our count. So
okay. Do you think the CCO report would be a better data source?
Then well, I mean, it's sort of, the registry has a bunch of people that aren't in the workforce, to Tammy's point too.
Yeah.
But we're also going to miss people that are actually certified and not on the CCOs. So, I mean, there's kind of 6 of one, half a dozen of the other.
Yeah. Yeah. Okay.
But it's something to keep an eye on. And, but there is, I think the THW commission has a dashboard that they utilize. I can try to find it and put it in the chat.
Okay. Yeah, if folks have feelings about about data sources on those measures. Now would be very useful time to share that with us. And you can just email me directly.
While I'm off mute. I thought it was really cool how the youth part was done in conjunction with the ADPC, and those youth strategies are going to span several agencies. I thought that was really awesome. So good work on that. I know you guys had a big hand in that. So it was cool that other partners can see the work that the youth are doing in the system of care and on SOCAC. So good job.
Lana.
Thanks so much, Lana. I'm trying to find out if there's a public place where temp lodging numbers are published. So I'll get
It's
that.
in the it is in the dashboard. It's a little bit buried.
But I'm wondering if DHS publishes it, like, because ours has a lag, right? So is there a place somebody could go for like a monthly report? I feel like there is, but I can't, when I Googled for it, I couldn't find it. So I'm asking somebody at DHS if they can direct me to where that might live.
Probably in ORCID. Do they still use ORCIDs?
Mm-hmm.
Yeah.
I do see it in the data dashboard though, again, students for that one year.
Which may be how like we measure it, Corinne, for the purpose of our plan, but I think they are supposed to do, I think it's like a 3-month lag, and that's less of a lag than we have. So if you're sort of like wanting to track that number more day to day, I think it is online somewhere. I just can't find it. My Google skills are lacking.
Okay, well, we're almost at time. I'm just going to do a final kind of call for any final questions or comments. I've just got a little bit more information about next steps in our public feedback process that I want to make sure you all get before you jump off. Okay. Well, I really appreciate the feedback you've all provided so far, especially on the measures. So I've got a couple of homework assignments from this conversation related to the measures, which is really helpful and timely. And this is not the only conversation we'll be having about this plan. So just want to share a little bit about what we've got coming up here in the next 6 weeks. Um, so as I mentioned, the full council is going to be having an in-person meeting next Tuesday, really digging into the details of this plan. And that will then officially kind of, once they have a chance to look at it, we'll then be able to share that more broadly with community at large. So we'll be sending out lots of emails to folks, really asking you all to share those emails with your partners, with people you know, personally, professionally, folks who you think might be interested in seeing what this plan has entailed. We're also going to be putting together a very brief survey that will be asking people for high-level thoughts. Is this plan directionally correct? If you participated in the development, do you feel like your ideas and considerations have been captured here? Are there particular things you want us to prioritize? So there'll be a quick survey that will be coming out as well. We also always welcome emails to our inbox. Nobody ever emails us really, but we always look at that inbox, and that's a great way to kind of like tell us directly what you think. We're also going to be having some expanded public comment period time at the November 4th and November 18th SOCAC meeting. So if you really want to kind of come online and share some thoughts or ideas with the council directly. There'll be time for that. And then finally, we're going to put together a little feedback party. So this will be held November 12th from 3:30 to 5, probably a little bit similar to this learning collaborative, but or a chance for anyone else who wants to come and learn about the plan, provide feedback on the plan. Really hoping to have youth and family in particular engage in that feedback party. And we'll be sending out information and registration links soon, so you can get that on your calendar. And again, really thank you so much for being here, and really hope that you can help get this plan validated and make sure that it's really what people need and want to see happen. And with that, I think we're done. No Learning Collaborative next month as it falls on Veterans Day. That's a state holiday. So we'll have one more Learning Collaborative December 9th. Same time, same place.
And I told her what had occurred and that I would just keep my rent and move out since I had changed.
Christy, did you have the feedback survey link?
Yeah, let me see if I can pop that in. Let me see.
And when is the next SOCAC meeting? Well, you guys are.
So there's the in-person one on October 21st. There is a remote option to watch or participate. We'll have when we go into like small groups, we'll have a breakout room just for online participants, and that's really like super just digging in deep in the weeds on the strategic plan. And then those 2 November dates that Christy listed a second ago will be the next 2 online SOCAC meetings that are our normal sort of time, 2-hour chunks. The October 21st is a 4-hour haul.
So I don't see the October 21st one. Did you guys send that out? That's the one I'm missing.
Well, we could have screwed it up, Chris, because I think calendaring is not my greatest skill. And we just got advice from the Oregon Government Ethics Commission that we need to remove the attendee lists from our invitations. And so we had to figure out how to do that. And it required installing a new version of Outlook and doing all sorts of stuff. And so I tried to fix that today. I may have deleted the meeting from your calendar. Let me double check and make sure you've got it.
Thanks. Because I'm looking, I'm like, I don't see this, but I remember looking at emails you sent and being like, yes, I'll be there, but none of it is showing up now.
I'm just going to forward you a copy. And if anybody else wants a forwarded copy, please let me know. You can email me or email the statewide email address that Christy posted a second ago. I'll put my email in the chat so you have it. Oh, got you, Heather. And thank you, Dion. Really appreciate your comment. Chris. All right. Cool. Thanks, Christy.
All right. Thanks. I'll see you tomorrow. Bye, everybody. Thanks for being here.